My name is Dr. Geoffrey Mutuma from the Zabes Hospital in South Sea, Nairobi. And we're having these episodes or these recordings which we are talking about diseases because we have found that actually people have got diseases and sometimes we perish because of lack of knowledge. And that's why we have decided it is to give people a bit of knowledge about the diseases. At least we have talked about pneumonia, we talked about diabetes, and we have talked about hypertension today. And we also talked about arthritis. Today we need to talk about abdominal problems. Abdomen, or what we commonly call the stomach, is the main function or the main organ or the main place or which is very important to everybody. Remember the stomach, we work because of our stomach. You normally do anything after your stomach is full. And that's why I find that actually nowadays we have got a bit of overweight because I think we have got a bit of money, and after we have eaten and our stomach is full, is when we start doing other things. And that's why you find that nowadays we have got an issue because of weight, which I'll talk another day. But today I want to focus mainly on abdominal upsets. Abdomen is quite big, and the abdomen is contains so many organs, and abdomen has got so many ailments. So I would like to cover as much as possible today about abdomen. And the abdomen starts from below the ribs up to hip joint. That's all abdomen. So there are so many issues which are mainly in the abdomen. And abdomen, in medical terms, we like to divide it in 4 or 5 places. First, there's upper abdomen, which got epigastrium, which is mainly people have got epigastrium pain when they got hyperacidity in the stomach. And then we have the middle part that's around the umbilicus, that the middle of the stomach, and we have got the lower part of the abdomen that's above the pelvis, or where the waistline. There's middle part. There's also an abdomen, and there's got the left part of the abdomen, which mainly there is colon, and the right side of abdomen where there's appendix. So it means that when a patient comes to hospital and says that, Daktari, I've got a problem of my stomach, it's normally very difficult to know where that stomach is. And remember, there's the stomach, sometimes, especially for women, they have got stomach of the baby and the stomach of the food. And normally, most of the languages, like mine, is that there's no difference in those stomachs. And the people say that I've got stomach, and they just ask which part of the stomach is painful. And that's why, in most cases, find that when somebody has got issue of the stomach, the first one, which we do, apart from what the patient says, and because sometimes patients have got a problem of saying exactly where the pain is, we normally like to touch the stomach and see which part of the stomach is painful. And today, first, I would like to start with the stomach, which is up in epigastrium. That's just below the ribs and in the middle. That's, you call it epigastrium pain. That's quite common nowadays. And nowadays, and this is something which has come quite recently. It was not there some 30 years or even 20 years. But nowadays, we have got a lot of people with hyperacidity. We've got a lot of people with peptic ulcers. We've got a lot of people with stomach ulcers. And these have become so common. And it's become so common nowadays. And even more worse is that before, stomach ulcers or peptic ulcer disease, PUD, used to be common in adults. But even we are getting children, very young people around 10 years, 15 years, they already have hyperacidity, and it's because of infection of something which called H. pylori. H. pylori, or Helicobacter pylori, is a bacteria which increases the acidity in the body, or rather, in scientific terms, they reduce the pH of the acid. Remember, the higher the pH, the better the body, or the better the stomach environment. But you find that when you got H. pylori, the stomach has got a lot of acid, and you find that because of that acid, there is erosion of the mucosa. The way the acid can erode the skin. When the stomach has got a lot of acidity, it means that it can erode the mucosa, or the covering of the stomach. And that's when somebody has got peptic ulcer or stomach ulcer, which becomes very painful all the time, or painful when you take some forms of food. Now, one thing we need to know is that a stomach is acidic by its nature. And the main reason of this acid is actually to be able to digest food. Remember, we chew our food using our teeth. It goes down to the stomach. When the stomach has acid, and that acid is used actually to digest. All the enzymes in the stomach actually digest and the food and make it more available to the body, because when the food is not digested well, it's not available to the body. No. Now, the acid is very important. So the stomach is very acidic, and that's often that when you vomit, you start feeling burning of the acid from the stomach, because when acid is in the stomach, it's okay, but when it gets out, especially in the esophagus, you feel that there's burning sensation. That's acidic, and that acid is very important. Now, when you got H. pylori, or you eat some few foods, there are some foods which increase the acid of the body, especially the onions and spices. Onions, when you eat something like the dania, it increases the acidity. When you eat something like hot pepper, it increases the acidity. And that beans also increase the acidity. The skuma wiki it also increases the acidity in the stomach. That's over that. Most of the food which have sour taste, most food which has a taste and a heavy taste or a sweet taste, sometimes are not good. They normally increase the acid in the body or in the stomach. And basically, that acid is very important because it is used to digest. That's the fact that there are some people who when they eat food with hot pepper, with pepper, they feel better because of the level of acid in the body, so in the stomach. So the level of acid in the stomach is not very good because it's used to digest food. It means that sometimes when you eat food without that taste or spices, the digestion is not complete because the acidic level is very low. So acid is very good, but normally when it reaches very high, especially exaggerated by some few foods, then that actually becomes dangerous to the body because it erodes. It causes superficial erosions into the stomach, and when it causes superficial in the stomach, there's ulcer, and that ulcer normally progresses to be cancer most of the time. That's often that cancer of the stomach is cancer number 3 in women and cancer number 4 in men. Is because it's quite common because people have got H. pylori. Most people have got epigastric pain and heartburns. They normally have H. pylori. And H. pylori, as we know nowadays, is not very easy to treat it. It normally causes a lot of problems to the body. And nowadays, we're having so many people who got H. pylori. And one thing with H. pylori is that the treatment is not very easy because you treat, and after finishing the first dosage, it does not go away, and then you take another dose, it does not go away. It's a bit stubborn when it comes to treatment, but the more important thing is that you have to make sure that the H. pylori is treated and cured, because unless it's cured, it will give you a problem later, because the way I've said is that H. pylori is one of the risk factors or the major risk factors to cancer of the stomach. That's why as the rate of H. pylori infection rise, at the same time when the rates of cancer of the stomach are rising, and that's normally the case which we have here in Kenya. Now, when you've got H. pylori, what you do, you need to be treated, and I've talked about it. But normally what I advise people is that for H. pylori, I know so many people are taking oral drugs, but mainly the H. pylori, what I've seen and what I've discovered that it's very important to be given IV drugs. IV drugs means that the drug is given in your vein, because H. pylori, the way I've seen that, is very stubborn infection nowadays, and most people, whenever they're given the treatment, they're never cured, and they take a lot of time to be cured. So it's very important that when you got H. pylori, you get the correct treatment so that you become okay. Now, still, as I've said, and I've talked about arthritis, which I talked about supplements, which are normally very good, is that also in the H. pylori, we've got supplements we give, which clear, they don't treat actually the infection per se, the way the products can treat and heal the arthritis. The way I've talked in another time is that when you've got H. pylori, you need to be treated, because H. pylori is a bacteria which need to be treated. For supplement, they don't do anything, but there are some few supplements which, if you ring me, I'll be able to tell you to direct which one they are, and what is more important and what's more very very factual is that H. pylori is a serious infection. Stomach ulcer is a serious disease. Normally, when you are treating, because this is very important on treatment of H. pylori and peptic ulcer disease, is that apart from giving the people the antibiotics and other drugs and omeprazole, which is a protein inhibitor to reduce the production of acid, is that you need to be done endoscopy to check what is happening in your stomach, especially for those who have got a big ulcer for a long time. I've said, when you've got acid for a long time, or got peptic ulcer for a long time, you've got stomach ulcer for a long time, that ulcer starts confers to be cancer. That's why most of the people have been having H. pylori, most of the people are having peptic ulcer disease after some time. It converts to be cancer, and that's why it also do endoscopy. Endoscopy, we put a tube in your mouth and it goes to the stomach. We check how it is compared to advise to tell you that The ulcer you have is a clean ulcer, or the ulcer you have is quite an ulcer which you progress into cancer, or is ulcer which you had now is already cancer. And that's why I said the cancer of the stomach is quite common. It's just because of H. pylori and stomach ulcers, because that's what's happening nowadays. So what is very important, and the parting short, is that peptic ulcer diseases are common, stomach ulcer diseases are common, and the best way is make sure you are treated and you are healed completely, because if you're not, it will progress to be malignant, and that can be a quite a major issue to the person. My name is Dr. Geoffrey Mutuma. My number, if you need to call me, especially for supplements, especially to be able to know more about H. pylori, is 0722-801-299. That's the number which is for Safaricom. For Airtel is 0734-801-299. Those are two numbers we have. And always, when you want to catch me, I'm mainly in Zambezi Hospital in South Sea, in my main road, and we open 24 hours. We have got both the services for outpatient and services for inpatient, and also as a hospital that, and of course, because of my background, we normally see a lot of patients who have got cancer, and also we, apart from treating for the cancers, we normally do a screening for the cancers, and also do cancer awareness works, which we normally do in February and also in October. In February this year, we did in Mombasa, we did in Mombasa, we did in Machakos, we did in Nairobi and Thika, and this we did on 26th of February. And this year again, we also do in Meru, we do in Makueni and Kwale, we do in Meru on 30th of September, we do in Makueni on 7th of November, and the Kwale we do in 14th of November. These cancer walks, we normally create awareness and screen people so that we can be able to create awareness, because cancer, as you know, is a major disease which you are having nowadays. And the only thing we can do about cancer is awareness, and also we do the screening and early diagnosis so that at least people can be able to be discovered as early as possible when they've got cancer. So thank you very much, and I wish you a good and happy day. Asante.